In every job, whatever you do, it is important to have a focus on quality and making small steps to make processes easier. Within the health and care sector, we all have a part to play in continuously improving and finding ways to do things a little better for the people who use our services. We call this process quality improvement, or QI for short. So you might be asking, what's quality improvement got to do with me? In a nutshell, it's everyone's job to improve quality, and this is most effectively achieved when it engages and is led by both those working in the service and the people who access and experience those services. This approach ensures we can identify and generate ideas from everyone's perspective. To help with this, we use a QI approach, using small changes in our everyday work to make big overall improvements over time. Quality improvement isn't random, it's carefully planned, and it's your chance to make a difference. It involves listening to the voice of the people who will be impacted by the changes and working with them to reach an outcome that benefits everyone. QI is a recognised method for developing, testing and implementing changes so that improvements can be made quickly but in a planned way. There are often competing pressures within services, and it can be tough to think about improving when our working day already feels pretty busy. But the point is, we're not always talking huge, complex projects. Often it's the smallest changes that can have the biggest impact. Some examples of small changes that can be made to improve quality are text reminder services to help people attend their appointments on time, working with teams on the way they share information about their patients, changing the ordering process for medical equipment to better monitor stock levels and think more sustainably about our waste, improving signage across sites to make it clearer where someone needs to be for their appointment. The changes we make should be thoughtful, meaningful and become part of our routine. We want to work with people who access our services and focus on what matters to them. So how do we actually make things better in practice? Quality improvement first started in manufacturing years ago and moved into the health and care sector more recently, so we can learn from the experiences of other organisations. One good example is the model that the Institute for Health use. This model says that when we're thinking about improvement, we should ask 3 questions. What are we trying to accomplish? How will we know that a change is an improvement? And what changes can we make? These questions all make up the model for improvement, and the answers to the questions help shape the next steps that need to be taken. Essentially, we make a plan to do something, we try it out, see what happens, and then act on the result to tweak things the next time around. The trick is to keep testing and learning, to build up lots of small changes that add together to make a big difference. The effect of this can be really significant and benefit patients across organisations and beyond. We hope that by showing you how simple and effective implementing QI can be, and by highlighting how we all have a role to play in improving quality, that you feel inspired to give it a go. If you've liked what you've heard in this video, there are plenty of opportunities for you to get support, learn more and start putting your learning into practice. You can visit our ICS webpage for access to QI resources, case studies and links to local and national training opportunities. You can also join our system improvement community through our Quality Improvement Network. The network can support and advise you on your quality improvement ideas, as well as signpost you to resources and opportunities to get involved.